अस्सलाम वालेकुम सर।
बैठो। नाम?
मोहम्मद उमर इमरान।
उमर?
यस सर।
Okay. What is the components of pentavalent vaccine?
Sir, pentavalent vaccine has 5 components: diphtheria, pertussis, tetanus, Haemophilus influenza B, and hepatitis B.
Okay. Why this vaccine is very important?
Sir, this vaccine is important because it saves us from many like fatal diseases like meningitis, pneumonia, and also whooping cough and hepatitis.
Okay. What is HIV?
Sir, it is a human immunodeficiency virus.
Okay. And what is HIV? My question is what is HIV?
HIV, sir, it is Haemophilus influenza type B vaccine.
Okay. So why we gave this vaccine to the child?
Sir, we give this vaccine to the child so that to like prevent the meningitis and pneumonia in the child.
Can you tell me the 4 conditions caused by Haemophilus influenza?
Sir, Haemophilus influenza causes meningitis, pneumonia. It can also cause.
What is the route of pentavalent vaccine?
Sir, it is given intramuscular.
At which area?
Anterolateral thigh.
At which direction? Can you tell me the injection direction?
Sir, literally? No.
What are the side effects of this vaccine?
Side effects, sir, it can cause like erythema at the site of infection. It can also cause fever or allergy, or it can also cause hypotonia and hyperreflexia.
Hyporeflexia? Are you sure?
Hyporesponsiveness.
Hyporesponsiveness.
Yes, sir.
Let's suppose the baby child is very worried, the father, that if the baby develop hypotonia, तो वो तो परेशान हो जाएगा, तो फिर आप आगे क्या करेंगे?
Sir, we will counsel the parents of the baby because usually hypotonia resolves in like 2 to 3 days, so there is nothing to worry about. As compared to like we will also tell them about the advantages of getting the vaccine.
Okay, last question. Can we give pentavalent vaccine to a baby at the same time if you are planning to go with other vaccines as well?
Yes, sir.
Are you sure?
Sir, other vaccines
Like polio vaccine, if you plan for any type of vaccine to give the baby, but you think also I want to give pentavalent at the same time.
Yes, sir.
Can you tell me?
Yes, sir.
Okay, and tell me the contraindication.
So contraindications can be like encephalitis, prior hypersensitivity to the vaccine, and also, sir, if the baby's immunity is not mature enough, so like we will not give.
Next,
Next, sir,
tell me again.
sir, encephalopathy, and also if the immunity is not mature, prior hypersensitivity and allergy.
Okay, so the PED station is over. Now we are going toward the examination part. Okay,
Yes,
this is the
वेलकम सर।
आपका नाम?
मोहम्मद उमर इमरान।
अच्छा, मुझे दिस पेशेंट एंड सडनली वेव्स इन द मॉल, प्लीज डू बेसिक एक्सरसाइज।
ओके सर। सीन सेफ्टी, नो फॉरेन बॉडी। हेलो भाई, आपको मेरी आवाज़ आ रही है? इस पेशेंट को सांस नहीं आ रहा, कोई है जो मेरी मदद करे? 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010। इस मरीज को ना सांस आ रही है ना पल्स आ रही है, कोई एम्बुलेंस को बुलाए, को एडी लेके आए, मैं सीपीआर स्टार्ट करने लगा हूं। 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30। 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23।
आपने कुछ क्या बताया?
सर, गुड सीपीआर होता है जिसमें हम 100 से 120 कंप्रेशन देते हैं पर मिनट। 5 to 6 सेंटीमीटर या 2 इंच तक डेप्थ होती है, पेशेंट रिवाइव कर जाता है, किसी किस्म की रिब्स ब्रेक नहीं करती। और
अच्छा, पेशेंट रिवाइव कर जाए तो क्या करोगे?
सर, पेशेंट रिवाइव कर जाएगा तो उसको लेफ्ट लेटरल पोजीशन में लेटा देंगे।
अच्छा, ठीक है। एम्बुलेंस आ गई तो क्या करोगे?
एम्बुलेंस आएगी तो एम्बुलेंस में डाल के सबसे पहले हम ईसीजी करेंगे और